Thanks for joining us for Good Day State Line. Dr. Shallow joins me in the studio today to share with us how upper cervical care can help with head injuries. Good morning, Dr. Shallow.
Yeah, good morning. There's one thing that we need to remember about head injuries, and it's easy to think that if there's no blood, you're fine. But the fact of the matter is that when a force comes into the head, it's going to go somewhere else too, depending on the angle of the force. One of the neat things about the head is that all the parts of the head are designed to absorb a blow to the head. It's kind of like the way your cars are designed. They're supposed to absorb a crash, absorb the force of the crash. And oftentimes what happens is a force comes in from the side, and that transfers around the whole outside of the skull, but it can also go through the structures of the skull and actually push them out of position. And so there can be things that happen inside the skull, distortion of the brain tissue. But here's the interesting thing, and this is where we come in handy, is that a head injury isn't just a head injury, it's also a neck injury. Because our heads, basically a 12-pound bowling ball, depending on your age, and are set right on top of this little 2-ounce bone called the atlas. And it's a very movable surface, and it can actually get pushed off of its platform. And once this area here is deranged, then it interferes with the blood flow in and out of the head, which is going to create plumbing problems in the head. And what we're now understanding better is that it's so critical for the brain and for the function of the brain to have oxygen coming in and all the waste products of brain activity to come out. And if that plumbing is stuck there, then we get this back pressure, we don't get enough oxygen, and then you get all kinds of nasty symptoms. Symptoms like foggy thinking. A lot of people that we've taken care of have had headaches. But the fact that it has transferred forces into the neck also mean that anything happening in the neck or below can be affected. Does that make sense?
Yeah, it seems like the entire process that you just mentioned could take a long time too. That you might not realize that a symptom you're having was from something that happened to your head months ago, years ago maybe.
That's exactly right. I had a patient many years ago who the signs were pointing to the fact that she had had a head injury. There were some postural distortions, whatever kind of symptoms, I don't remember what they were. But after I analyzed the x-rays that we take of the top of the neck to find out where everything got to, I realized she'd had a head injury and she didn't remember one. And then I told her, you know, you've had a head injury. And she said, oh yeah, 4 months ago I drove a four-wheeler off a cliff and it landed on my head. And how many of those events can you think of that you forgot all about? And
usually not something that severe, but it can happen.
Yeah.
So tell me a little bit, you've obviously already proved you're very, very, very intelligent when it comes to these brain injuries or head injuries and trauma. Tell me just a little bit about upper cervical care.
Well, upper cervical care can be actually, the way we practice it with the NUCA procedure, it can be adequately described as a little bit of nothing. And because you can't feel the corrective force that we put in there, it's very specific physics. And we're taking a look at where the head is, the size and shape of the bones here, and the size and shape of the bones underneath. And then our goal is just to bring it all back into balance. And once we've done that, then the neurologic signs clear up. Everything from eye function to how the face works, how your jaw works, how your muscles work, your ability to stand up straight. Why is that? Because this is the control center. And everything that has to happen in your body starts as a signal up here in the head and has to go through that area. Make sense?
Yeah, and so you've described all of the reasons why you would want to come see upper cervical care. What's the first thing you do when someone shows up with a head injury or suspects it?
First thing that we want to do is find out what a person's story is. What's their story about what's happening in their bodies? And what's their history? You know, did they have a birth injury or some sort of trauma in the past? And then we do a real thorough examination to find out, well, is this real or is this just something that's made up? You know, we actually want to test and see, you know, is this person making it up? And the tests are going to show us neurologic problems, muscle asymmetry, muscle contractions, postural distortions, can't stand up straight. Once we've determined that there is a problem here, then we're going to take some real specific x-rays of the top of the neck according to the NUCA protocol. And then we just have to restore it. And once we've restored that connection, that balance in the top of the neck, then we just have to immediately verify. And so we take new pictures and we verify that we've restored that relationship. And then it's just a matter of waiting for the body to process that. Healing sometimes can happen instantly in a sense that you can feel it right away, but more people than not, it's going to be a process of feeling some changes, and then weeks or rarely even months later, then we're going to have some changes. I have actually some images. This is one of the tests that we do, which is called a brain gauge test. And this is the before test. And this is an adult who grew up with 3 brothers, and he didn't remember any head trauma, but they used to drive 4-wheelers all over, you know, around the river. And, you know, 4 brothers, they're not going to be sitting and playing cards all day, right? And but this is his brain gauge study, and this little tiny red dot here tells me he had a head injury in either the front or the back of the head. And about 6 weeks later, we took another study, and look at how nice that is. Everything is moving into the green zones. We've got in this description, this sort of graphic, we have more function being described in the brain.
So clearly your tests are proving that you are able to help someone who maybe thinks that they have a head injury, and the first step is to come see you. So where could we visit you? Right. Where could we get some more information?
So we can get some more information at my website, which is myrockfordchiropractor.com. The procedure that we use is a specialized chiropractic procedure, and we're considered specialists. And so that's where you can find out more information.
Well, then we got all the information up there, and I'm sure you'll have some people coming to see you. Thank you so much for stopping by. After this quick break, I'll introduce you to attorney Jonathan James. We'll be right back with more Good Day State Line.